Okay, hello everyone. I'm already see some people here. I hope you can hear me and see me well. We have a chat. In any case, yeah, I see some likes. Please let me know on the chat. We will wait a couple more minutes for other people since there was more people signed in the this event. Mm, what I can say, all the questions and any anything you would like to ask me, we will leave for the end of the today's topic. What we will do, the today's topic is the trends, are the trends of aesthetic medicine, and I would like to compare it to the program of studies, yeah, of the practical week in Madrid, but also for studies. That's what you can learn during the going through the platform. So I have already the schedule of the practicals lesson for the practical week for November. I will be also present there as a teacher together with Agata. Maybe some of you had already occasion to saw her live. So there will be a lot of stuff, really useful, really different procedure, different products. What is also important, the different brands, because as you are from different countries, you're working in a different type of fillers, of different type of Botox and mesotherapy products. So that's really useful. As me, I was also the student of Amir 2 3 weeks ago, years ago, and the thing was we learn on a different product, different brands, and it was really useful because later you go to your country, you can check it on the Google, and you know what is the feeling of let's say injecting the hyaluronic acid, yeah, inside the patient, which is in my opinion quite important. Probably some of you here are people who are beginners. Some of the people are more advanced. This happens every year, so I would like to try to normalize the level, uh, and I hope every one of you will be satisfied from spending with me here today 1 hour of your life. So regarding the trends, as you probably know, we are in Europe. I'm from Poland. Madrid is in Spain. So we generally basic in the trends which are in Europe, yeah, around it. Last years, the trends become more, how to say, rejuvenation medicine than the fillers, more the regenerative medicine than the fillers, yeah. And this is my opinion working in the patients. I have about uh, approximately 45 65 patients every week. So it's giving about 200 a month. I'm working also in hospital. I'm working in the field of oncological surgery, and mostly in the breast surgery. And the thing what give me the best take from the Madrid was that we had also occasions to work on body. Since in Poland, in the most of the year, there is no light. Yeah, we have a dark. There is no sun. Uh, Madrid is the sunny city, so the people showing the body more often than in Poland. So we had occasion in Madrid to practice a lot of stuff in the body, which is really useful. Since I came to my country, start to work, not many physicians offer the treatments for body. There is only face, yeah, because we're showing only face on the streets to the people. So yeah, that's my let's say comparison for it. So I will open just for a moment the schedule of the practical week. Yeah. So, and I will try to compare that what you have, what is going with the trends. Yeah. So as I said, the trends are more regenerative, rejuvenation than the fillers, than the going into the volume. Um, Many technology came to Europe from USA, from Asia, speaking about lasers, speaking about uh, about uh, typical mesotherapy products. And even in Poland right now and in Spain, we have the same companies, yeah, the same brands. The thing is, most of the products these days, they have some peptides, they have amino acids, but they have also vitamins. And that's quite funny. I start to work with the vitamin B12 to like it's a big complex mixed for injection also into the suborbital area. Yeah. So you can use it in lower eye, upper eye, including eyelids, and it's safe. Yeah. You have in PubMed many publications about it, and that was my surprise. One of the doctor 3 years ago showed me in Madrid uh, this type of vitamins can just lightening if you have darkness below the eyes. And it was really, really great opportunity for me when I work with the people from Africa, Arabic people, women. They have a really dark under eyes, yeah, because this is normally genetically, and it gives really nice improvement. Of course, if the patient want it, yeah, we do it everything for patient. The difference, yeah, between the aesthetic medicine and classic medicine, we here are basically, according by the definition, not exactly treat. We treat, but some, let's say, uh, definitions, sorry, some demarcations of the patient, some things that patient don't like, yeah. But we basically not treat the health. So going to the trends, yeah, we speaking also about the minerals. That's quite funny thing, I'm also working as a trichologist. Every patients come to me. I'm generally sending them to the lab to do the blood test. We starting, from the zinc, from the B12, folic acid, cortisol, cuprum, mangum, iodine, yeah, of course, the thyroid. And the funny fact is, if the patients have money for it, because everything is about the money, and they have a time and they want, you can really do a lot of, because aesthetic medicine are not only the fillers, are not only the lasers. Some of the people also take the aesthetic medicine as some surgical procedures, yeah, a little slightly surgical. But this is also that how we live, epigenetic, yeah, our lifestyle, our food, our physical activity. That's what we want, what we're doing, yeah. So the thing is, you have to find in aesthetic medicine that what you like the most. In my case, I'm working with the noses. The noses are done, as you will see also in aesthetic practice week in Madrid, by the hyaluronic acid. It's quite dangerous, yeah, because you can make the occlusion of the ocular vessels. But this is something I have here. I'm in a city about 1 million people, and maybe about 20 doctors are doing it. Yeah, so this is something I have from it. So yeah, going to the schedule of aesthetic medicine. Uh, yeah. In the beginning, you will have some anatomy. So this is basic, not related to today's topic, but you will have the facial mesotherapy. Yeah, facial mesotherapy, as I told, lot of stuff, because you can use generally basically everything what is related to the injection, to the mesotherapy. Yeah, you can use, let's say, from the basic things, even the saline. What is doing saline? Inflammation by fibroblast, yeah, production. And do you have effect? Yeah, we have inflammation causing the regeneration of the tissues. Example, yeah, maybe stupid, but it works, yeah. but mesotherapy as a general. So in a practical week, you will see the mesotherapy of the face, upper face, middle, lower, also the eye area, also the neck. And there will be also part when we will work in mesotherapy on the body for solving of a fat. Speaking about the trends, what is happen generally right now in the Europe, the oxyholic acid. So the acid which causes the increasing metabolism of lipid tissue locally. As funny is, in many European countries you have different law, yeah, starting from the aesthetic school, waiting for the law relating to the description of the patient, documentation, speaking about other any stuff. And let's say the mesotherapy stuff with the deoxyholic acid is illegal in Poland. It's not registered as a drug, as any medical manufactured product. It's not. It's illegal. Yeah, that's quite funny. Of course, company find a different way to work with it. We have the precursor of collagen. It's called tropocollagen from the Guna company. Not spoiler it hit anything, but only I think this company making tropocollagen, and it's also popular in Spain, Italy, Portugal, France, and in many conferences it's also present. And there is many difference of these precursors. Yeah, also this one which can break the bonds between the tissue. Yeah, so the mesotherapy. Of course, what we can do also mesotherapy, the PRP. Yeah. So the blood taking also will take a place in the Madrid. So be ready for it. But patients love it in aesthetic medicine, love it in a trichology, and the results are also great. Are great in the giving the natural, let's say, baby face in the hair. Compared with the finasteride or minoxidil, also great effects. And the effects are really can be taken in a short time, so that's really nice. What you can see, and this patients really like it in Poland, like it also in a different countries. In Europe, also 2 types of the systems are present. The system which are called the closed system and the open system. You will also have a deal with it, and you will see what are the differences. As I know, according by law in Spain, only the closed systems are let's say legal to use. Yeah, legal meaning in case if something happen, then you will have a problems. Yeah, so that was from the beginning. Of course, there will be much more. So let's talk about the biggest topic and maybe the most interesting for all of you. Botox, botulinum toxin. Yeah, the most popular these days, can be used in many different parts of the body. To be honest, the companies which are produced the botulinum toxin, they can offer you plenty of courses when you buy the products. Yeah. And they are from different parts of the bodies. You can share the face for upper, middle, lower. You can do it for the muscles of the neck in case of tension, for hyperhidrosis in the hair area. Yeah, you can do it for hands. And the funny fact is many people love it, and it's crazy because it's really painful for them. Going to the other botulinum toxin use, of course, the fits, of course, the area of the genitals, but I'm not doing it. There is many other gynecologists which are doing them. Also the axillary area. Also, it can be used also for some doctors start to do it if you want to have a better seen the abdominal muscle, especially located in the ribs area. They can also be done something similar to the baby Botox. Yeah, so that's the stuff. And the Botox is still on top. It's still done all the time. So what I can say, yeah, this is really the trend. And these days more and more common is the full face Botox. Yeah, because it's giving really smooth face look together with the bruxismus. Yeah, with the when you have too much tension in the buccal muscles. Yeah, So, going to the next topics, the non-surgical rhinoplasty. Yeah, plastic surgeons hate this name because non-surgical rhinoplasty it's surgical. Yeah, so how it can be? But in English, it's the simplest translation. So we will also see this in the Madrid in Practical Week. Effects are great, spectacular. You just only need to train a little bit. The best if you have also ultrasound because it gives you the safe and can cover you somehow if you know how to use it. So yeah, and in my opinion, is it popular? Not exactly, not exactly. More popular in the Mediterranean countries, not in Slavic countries, but the volumetry of the face, yeah, of course, it's really common. And in every congresses, you have special part from the volumetry, from the Botox, yeah, from the fillers. Going to the next one, the under eye fillers. Yeah, so we're speaking right now about giving the cross-linked hyaluronic acid under the lower eye area. Yeah, and to be honest, probably some of you who have experience with aesthetic medicine heard about the Tyndall effect. So the bluish coloration of the skin due to uh, due to due to juice filler. Yeah. So in Poland we don't practice it. In many countries there are some doctors who are doing this, but it's really depend and it's really personal. And to be honest, giving under eye fillers this day is not that big trend. As is, for instance, doing a fat transfer, yeah, so lipo transfer under the eye, and it's giving the great results, and also there's natural, yeah. But you will also see it. But speaking about the trends, not this time, yeah. Later we will have something which is called the blanching, yeah. So many injections of the needle. Yeah, generally by blanching you can give many products, many medicaments. So that's the only procedure, yeah. You will see. But what is really common all the time, and in my opinion will be still, the nasolabial fold, yeah. Nasolabials together in some people with bolus filling in the nose area. We're speaking here especially with the people who lost a lot of weight, the Ozempic faces. We're speaking about people who used anabolic steroids. Yeah, we have some decreasing of the fat tissue on the face area. And we're speaking, of course, about the elderly people or maybe middle-aged people, yeah, but elderly mostly. This is the thing if you want to see or if you want to do some great result or show anything on your face of your patient, when they come to you, the, let's say, elderly lady who is 75 years old, because there are cases like that. First time, because she wants to do something with herself. Let's say, okay, and you have to start from something to, let's say, invite her more as your client, yeah, and patient to the aesthetic medicine. So yeah, that's the really really important, I think, that how to speak with people, yeah, how to speak, how they feel with you, safe, just safe, yeah. And I know I'm skipping the topics, but I'm the person who is maybe not ADHD, but I'm rather the person who wants to tell you too much in too short time. So yeah, the nasolabial fold. Many different procedures, many different possibility of entrance, many different ways. You will see it by cannula, you will see it with needle, and this is really individual. The people or the doctors who are practicing, you have to try it. You have to try it, and you have to see what is for you better and where you will feel more safe. Yeah, because this is the thing. And we will have the chin jawline filler, so the volumetry. Yeah, it's called like this. So we just we can do the chin. Yeah, we can do the jawline. Quite nice. And for this, let's say you can use. Speaking about the trends, you can use the fillers, classical one, hyaluronic acid cross linked. Yeah, really dense fillers. But you can use also the polycaprolacton, let's say, and there are some of them in the market. You can use, like, say, work with the polylactic acid with filler, let's say, yeah, but to more advanced. And I will try also to people who will be with me in Madrid to show the best way how to work with it, yeah. Because the thing, aesthetic medicine, you find a part of the body, let's say, it can be the let's say lower half of a face, yeah. And the patients come to you. Some patients come because they want to do something specific, yeah. They want the botulinum for the let's say forehead. But some of them won't come to you and they will try to say, okay, let's do something. I want to have, let's say, better hydration of the skin, a better tension, and maybe a little bit of volume. Yeah. And you have to take to your head that, okay, we can use, let's say, this type of product, and we can give this product by different possible ways. Yeah. And also important is to talk with patients, yeah? We are not able to do the polylactic acid, let's say, to the patients who is not cooperative, because later you will have some granules under the subcutaneous tissue. And this is, you know, really deep. So I hope your story with aesthetic will give you this type of thinking. We will also work with the hydroxyapatite. Really great product, but for this we have to be careful. And yeah, this is also the trends, yeah. The trends, speaking about polylactic acid, polycaprolacton, hydroxyapatite, this all of them are the stimulators, yeah, the tissue stimulators. Long term, yeah. Because speaking about polycaprolacton, if you have more dense formulas, I will not speaking about the companies, sometimes they are, I think, up to 4 years. According by the producer, yeah, they can work to stimulate. Okay, and yeah, we will also work with some lasers. The lasers, what I can say. From Amir, from a lasers, you have different studies. Already they are only in the Spain language. But I hope in the future it will be also in English. Speaking about the lasers, about regeneration of the tissues, you know, it's always great. If you do fraction, no fraction, CO2, RDAC, NDAC, anything, it's great. But the only one thing is, everyone told me before I started working, you are not able to learn how to work with a laser until you don't work on only one. Because, okay, you know, there is a frequency, we have a wavelength, different, depends from the stones, we have energy, we have diameter of a light, yeah. But the thing is, every laser is different. And I had opportunity to work in the Tulum lasers, in others, and even in the same, let's say, settings, but different companies produce the device. Of course, it's a different way. Yeah. So, what else will be in the practical week? We will do also botulinum toxin for hyperhidrosis. Yeah. So the axillary area. We will do, of course, the lip fillers. Yeah. Lovely. Old patients, young patients. We will do also hydration of the lips, and there will be many of these patients, so don't be worried about it. We will also do the neck area. We will speak about the most important, you know, nerves and vessels on the neck, the triangles which you need to just watch out. And yeah, going to the speak about oh, and from the more important, speaking about the this year will be also the new one. Speaking about the stimulators, polylactic acid. Last years there was possibility to do, I think, the Botox, like the muscles or the area of the buttock. So this year it will be changed for the abdomen, and we will work, as I know, with the patients with the after cesarean section. You have a line, yeah, under the abdomen area, and you take a cannula and you just, it's called rigotomy. We cutting the how to say, the scar under the, and later you give the stimulator for it, and the results are great. From up you can work with a laser, yeah, great results. So you will see also this, and this is really trend, yeah. These days, you know, many women, especially after pregnancy, wants to carry herself, yeah, especially in Spain, yeah, when we're showing the body. So this is really also common. Yeah, we will go into the summary of the procedure presented of the in the practical week, and I will tell you more about the trends around Europe, as I'm the person who is from time to time on conferences, because you know it's the thing. If you are in Europe, there are some special conferences you have to see as an esthetician. So until you go the round once, yeah, through the, I don't know, Rotterdam, Paris, Madrid, Rome, Bologna, Mediolan, Milan, yeah, I don't know, Warsaw. There are some in Poland, some in Czech Republic, in Austria. You know how it's working, how it's looking, and it's giving you also the point of view. You have to do it once if you want to just know from where to take also the most adequate newses. You just have to do it once. And on the conferences, you know, also one thing, many companies pay also. You have the sponsored session, yeah, paid for the presentation of the product. But to be honest, the best thing is to look for the more, I guess, the passionate doctors, the young one, old one, and others, yeah, middle age. Why? Because, you know, there is something like the companies, they paid a lot of money for doing the tests, yeah, for writing the materials in the PubMed, yeah. Of course, the people are doing it. It makes sense. It's real, yeah. But if you have someone who is really into it and can tell you something, there are some special, of course, surnames, yeah, during Europe. And I'm not speaking about only aesthetic medicine doctors, but also about the plastic surgeons who are doing aesthetics. There's many of them, and they can give you some, not maybe something new, because many things is already, I think, presented in aesthetic medicine, yeah. This is not a field of oncology when we have to find a new drug for the special type of cancer, but you know, techniques, and you can go for many courses. The only thing is, you will learn something the best when you practice. And in Madrid, you will see all of the possible procedures or of the possible stuff. It can be a lot of for a beginning, but later you will see how you can combine them, how you can choose between them, and what will be the best, yeah, for you and for your patients. So the practice, and that's the reason why the intensive week, it's called intensive week, because it's really intensive, what I can say. Why? You know, from time to time, it was even from about 9 till, I don't want to scare you, 7 p.m. Of course, with the break, yeah, for dinner. So it will be really intensive. But the atmosphere is great, so I will be really happy to welcome you there. And regarding the trends about the conferences, about the Europe, yeah, across the Europe. So what I can say from my 4 or 5 year experience with aesthetic, and then also the surgery experience, since I'm doing also the breast implants, doing also some ears corrections and some other stuff from plastic surgery. you know, Botox is always on the top. So if you want to offer your patient something what will be great, this one, yeah. Mesotherapy as the name of procedure, yeah. So in the mesotherapy, yeah. About the words and the etiology, we will talk in Madrid. Many different products, many different regions, yeah. You know, mesotherapy. You can do, let's say, if the patient is after sun, after the holidays. There are also products with the non-cross-linked hyaluronic acids and special formulas, which you can give, let's say, for the arms. Yeah, if you have some laxity, you can give for the area of the knee, for the other people. You can give in the area of stomach, for the area of the back and other stuff, because you know the sky is the limit. People have really sometimes strange ideas, and it only depends how brave you are and what are you prepared for and how good you know the anatomy. Yeah, because here anatomy really makes sense. So the Botox, in my case, it's number one. This procedure don't give you too much money, yeah, because also the botulinum is not cheap. I know in different countries we have different calculations of the prices. Let's say in Madrid they count the patients for the bottle, but in Poland they count the patients for the areas. Yeah, so we have a 1, 2, 3, and it's different one. Yeah, it really depends. Second one, what I can say. The second one, in my opinion, the all tissue stimulators. And speaking here about the, as I told, all everything basic in the. Okay, let's maybe from the beginning. The definition of the tissue stimulator. What is the definition? Something which stimulates tissue. For what? We produce the inflammation. That's the reason why the patients cannot take the anti-inflammatory drugs, like say ibuprofen, yeah, during after let's say week 2 after giving the stimulators. And the stimulations causing the fibroblasts to regenerate, to reproduce. You have the whole, you know, biochemistry of a tissue, and we have a result. Yeah. So the tissue stimulator, basically, it's a huge word. Yeah. They are this one which are more safe and let's say less safe. As the polycaprolactone I told, it can take in a tissue up to 4 years. It's something, imagine, you can close your eyes, imagine you are in histology classes. And you can see on the microscope some specimen with a tissue. And there you have something which looks like mozzarella. Just, you know, you have a bowl of mozzarella and you try to take from this some little pieces. The shape is really not regular. It's sharp. Sometimes triangular, sometimes rhomboid, irregular. Yeah, and this is hyaluronic acid. And also, of course, it depends from the company, from the clarity, from the density, etc., technology, purity, and everything. But imagine you have the polycaprolactone, and this is spherical. Imagine you have almost perfect balls, and they stick together. Yeah, and that's the reason why polycaprolactone is also called the semi-permeable implant. Yeah, the semi-permeability or the dissolving of the hyaluronic acid. It's also really a huge topic. Since I have occasion to assistate for the rhinoplasty, the real one, this surgical with a plastic surgeon, we open some patients after the non-surgical, so with the dense hyaluronic acid. And to be honest and to be funny, even after 5 years, there are present with some residuals, yeah, of the hyaluronic acid. So this is really really interesting. Also speaking about this, like in community, everyone told, you know, 1 year and you will don't have it. Yeah, this is not true. Going back to the topic, first one, botulinum toxin. Second one, the stimulators. Yeah, the stimulators depend from the patient's needs. And what I can say, the third one, to be honest, lasers. Lasers, you know, if you have a good one in your clinic, you can do amazing stuff. Amazing stuff. I mean, you know, combining products with a laser give a great result. The only one thing, you have to know how to do it. Since in some products you have substances which are photoreactive, and that's the problem. And to be honest, in my career, nothing like that happened, and it's really rare. Even the patients taking the drugs from the list of the photoreactive, yeah, it's really rare, really. So in this case, just don't be worried, yeah. And the lasers also, you will see in the practical weeks, it's you will see IPL for sure, and I think NDAC, how it's working for melasma, for some hair depilation. You can use both of them for hair depilation. Yeah, only depends which result you want. So yeah, giving the summary of the trends, the top three. Yeah, botulinum toxin. Botulinum toxin, stimulators, and the lasers. Yeah, and about fillers. Okay, I will tell you something. There are some technologies in Europe from some years. They came at first, of course, from Korea to the USA and then to the Europe. We are maybe 10 years later than the Asia. Lip filler, yeah. Many of you probably wants to be the best in the lip fillers. It's, in my opinion, it's really hard. It's really hard because you need to practice. And I'm not doing them a lot of only for people I know, because I think there are better people who can do the lips, really. So the lips filler, okay, but you have to be also aware of it, that you will have to fix some stuff after someone using the hyaluronidase, waiting and doing it again. But about technologies, the lasers, there are also technologies in Polish market, also the Spanish, of the lasers, which you use in the red lip area, and they give you, let's say, quite similar effects even after first session, like the lightest hyaluronic acid, the cross-linked. Yeah. So this type of hyaluronic acids, the most light one, we use mostly for the let's say hydration of the lips, because many people, yeah, they have a dry lips and they want to hydrate it, and doing a contours, the shapes without, you know, just making them bigger. So that's related to the summary. Yeah, I think, you know, speaking about the most important things, that's all from my side. It was short. I really would like to invite you to the Madrid to the practical week.